Good, wonderful day. I'm Dr. Brittany Duggar from the University of California, Davis, and I'm here to talk to you in 5 minutes or less on TDP-43 deposition in a diverse elderly cohort of the University of California, Davis Alzheimer's Disease Research Center. For a little bit of background, neuropathology studies of dementia in U.S. persons other than non-Hispanic whites are few and far between. And this is a great diagram depicting this, put together by wonderful lab people, Miley and Emily. They basically looked at counts of papers on PubMed using the search term Alzheimer's disease pathology, along with the select demographic term that you see up here. Hopefully you can appreciate this lovely graph only goes up to 25. So there's a very huge dearth of studies that have been done on persons other than non-Hispanic whites. Hence, over a decade ago, the University of California, Davis Alzheimer's Disease Center changed their recruitment strategies. And this is a wonderful paper summarizing how they did that. But in 5 minutes or less, right? Keeping mindful of time, just to summarize the changes that were made. So in 2001, UC Davis Alzheimer's Disease Center changed their approach to try to rely more on community-based recruitment methods. This meant basically trying to screen at community events, giving educational presentations at local churches, senior centers, and support groups. Also, to help with recruitment, we actually split our clinical sites into 2 physical separate locations, which worked in coordinated fashion. One in the East Bay in California, East Bay meaning San Francisco Bay Area, and the other one in the Sacramento area. We also tried to decrease barriers by having in-home visits to administer cognitive testing and other procedures, driving participants to research visits, as well as testing offered in English and Spanish. Those are just a few of the highlights that we changed. And hopefully you can appreciate in this table right here that just popped up that before and after these changes were implemented, afterward there was a huge spike in minorities that were recruited. So specifically African Americans and Hispanics so with African Americans that went from 7% to 24%. And then with the Hispanics, it went from about 5% to 20%. So definitely this has paid off, which is very exciting because we have to have diverse cohorts. So with this, now leading on to the TDP, which is our highlight of this wonderful conference, the methods for this specific study, we used the UC Davis ADRC cohort of persons who had passed away with available TDP-43 data that was recorded on the National Alzheimer's Coordinating Center Neuropathology version 10 form. Any statistics that you see with p-values, these associations were assessed with linear regression models adjusted for age, sex, and ethno-racial group. TDP-43 was assessed with a non-phospho-specific TDP-43 antibody. Just wanted to emphasize that because I know people are using different antibodies, but we use the non-phosphorylated one. And this was assessed in at least one of the following areas. So the amygdala, hippocampus, entorhinal inferior temporal cortex, and/or neocortex. So with this, we had a total of 123 cases. And on this pie chart depicted on your right or left, depending on if you're looking in a mirror at this presentation, most were non-Hispanic whites, but that was only at 70%. So we do have African Americans, Hispanics, Asians, as well as Native Americans. The mean age of death for the entire cohort was 86 years, 56% were female. And then when it came to cognitive status, 64%, so the majority were demented at the time of death, at the last evaluation before death. 15% had mild cognitive impairment and 15% were considered cognitively normal. The median Braak neurofibrillary tangle stage was 5 with a range of 0 to 6. And when we get to the meat of this wonderful presentation, the frequency of TDP-43 positivity in the select regions, so these anatomic regions that I discussed just a second ago, across ethno-racial groups within our UC Davis Alzheimer's Disease Center cohort. Hopefully you can appreciate compared to non-Hispanic whites, which are right here, Hispanics had overall lower frequencies, while African Americans had higher frequencies. But just to be cautioned, when you look at the total ends, this is out of all these ends are very, very small numbers. So clearly more research is needed. So in summary with these data, TDP-43 positivity was the highest, and this is with the overall group, in the amygdala at 35%, followed by hippocampus, and then least prevalent in the neocortex. With respect to those lovely correlation analysis. The amygdala TDP-43 was associated with BROC, neurofibrillary tangle stage, CRAD, neuritic plaque score, and cognitive status prior to death. The proportions, although remember to be cautious that these numbers were low, so we can't really do statistics with power and effect size to be adequate. Proportions of TDP-43 positivity in all areas were lower in Hispanics and higher in African Americans when compared to non-Hispanic whites. So these data, although very preliminary, confirm prior reports of association between TDP-43 and select Alzheimer's disease and related disorder pathologies in a more diverse sample. Data suggest Hispanics had an overall lower TDP-43 burden, and this is consistent with prior reports from our group showing less AD pathology in Hispanics. And thank you for your time.